Hello and welcome to the class on nerve tension pain. You took the quiz and you are classified as having nerve tension pain. So in this class, I'm going to teach you how to manage this condition and to get better. And we're just going to go through all the information that you're going to need to know about this specific condition. So let's jump in here. So the objectives of this class is to help you understand what nerve tension pain is and to differentiate it between the other types of pain in the McKenzie classification system. We're going to perform some tests, the slump test and the straight leg raise test, in order for you to confirm that you do have nerve tension pain. And then we'll go ahead and go through the management strategy for this particular condition so that you can manage it and get better. So just a case example here, meet Sarah. So Sarah did have a disc surgery for her leg pain, and it improved significantly, but she still had some tension in her leg, especially when she stretched her leg, when she would bend forward. And so it turned out that she had some nerve tension pain. And the nerve can get stuck or glued to surrounding tissues. This is common if there's any sort of injury to that area. And it's kind of like a sticky piece of tape on a flexible cord. When the cord tries to move, the sticky tape pulls on it and holds it in place, causing stiffness or pain or tension. And so this is a treatment approach that we utilize in order for you to feel better when that's what's going on. So nerve tension pain happens when there is this scar tissue or sticky spots that catch the nerve and don't allow the nerve to glide the way that it is supposed to. There is no centralization with nerve tension pain. So if you've been doing some of the exercises or other recommendations and finding that things are not centralizing, then it's likely that you've got nerve tension pain as opposed to one of the other classifications. And it usually happens 3 to 6 months after a problem. So you may have had back pain in the past and it never fully resolved, or you had back pain in the past, it did resolve, but now you're having kind of this nerve tension. So it kind of comes out of nowhere, but you've had a previous episode. So just so you're aware, this is not new damage. This is just nerve tension. And so once we get the nerve moving freely again, then you're back on track and you're able to do the things that you want to do. So let's go ahead and start with our first test. This is the slump test. This is how we check nerve mobility. So basically you're going to sit on a chair and then you're going to slump your entire spine here, tuck your chin, and then lastly you're going to extend the knees. You're going to straighten the leg and then you're going to pull the toes back. So you're looking for a familiar pain. You're not looking for a stretch. You may get a stretch in addition, but you're really looking for this familiar sensation of the pain that you're having in your back or in your leg to show up when you do this test. So next is the straight leg raise test. Basically, in this test, you're going to lie down and then you're going to go ahead and lift the leg straight up towards the sky. And at a certain angle, you might get that familiar pain pattern. That is what we're looking for. We're looking for that familiar discomfort or tension in the back of the leg as you lift the leg up towards the sky. Then you'll want to go to the other side and do this on the other side and compare side to side, figuring out if you have a positive straight leg raise test, which would indicate that you do have nerve tension pain. So what your results mean. So if either of these were positive, it confirms that you have nerve tension pain and that this is not a new injury. We're not looking for centralization. So if you don't have centralization, that's appropriate. And so you're in the right place, you're on the right track, and we have a plan for you to get back to where you want to be.